is to the Minister for Health. It's in the name of Deputies Clare Daly and Billy Kelleher. The need to address concerns in maternity service provision. I call Deputy Daly first for 2 minutes, Deputy.
Thanks, Ceann. Minister, obviously this issue is on the back of the tragic and unnecessary death of Derek, which really saddened people the length and breadth of the country. A young woman at her prime, just given birth to her first baby. But the real tragedy here is that this wasn't an isolated tragedy. Unfortunately, she is the latest in a long list of others. Savita Halappanavar, Nora Hyland, Bimbo Ananugua, Tanya McCabe, inquests in Sligo, investigations in Portlaoise, and at the middle of all of this are women hoping what should be a joyous occasion, giving birth to their children. And all of these things have happened under the watch of the HSE. And I'd like to put it to you, Minister, that what we have now is a systemic crisis in terms of maternity care for two reasons. Firstly, the cutbacks, which have meant that not a single maternity hospital is operating to safe ratios, but critically because our policy is all wrong. We have an outdated antenatal policy which hasn't been changed for years, when really we should be looking at developing a countrywide strategy of midwifery-led units. Instead, we have the HSE actively pursuing midwives. Now, I have to say, I find it sickening that on the same day as this death by medical misadventure was given against Sligo Hospital, where a midwife there said she couldn't tell whether the patient had jaundice or not because she was Indian, on that same day, an independent midwife of 31 years stalwart experience was handed down a decision in the courts where her state indemnity insurance was withdrawn. Now, this woman, Philomena Canning, all afternoon I've been getting emails from people who worked with her, for whom she was their midwife and is indeed their midwife. And what this woman's crime was not of killing somebody or leading to somebody's death, but observing all procedures and protocols. She transferred a woman to hospital after a home birth when the woman felt dizzy. That woman was discharged 10 hours later, herself and her baby fine. And because of the actions of the HSE, there are 10 women, many of them about to imminently give birth, who do not have a midwife with them. This is really serious, particularly when you see the list of fatalities in hospitals under the direction of the HSE, where nobody was suspended, let alone fired. And here we have someone of the calibre of Philomena Canning, who devoted her lives to women and proper birthing, where women have a choice in that. Minister, the policy is completely wrong. You've got to look at a decent and proper system of maternity care.
I want to offer my deepest condolences to Mr Michael Kivlahan and his son Dior and their families on the sad and tragic loss of Dara Kivlahan. I understand that the HSE has offered its sincere condolences and apologised to both families for the shortcomings in the management and care of Mrs Kivlahan at Sligo Regional Hospital. While cases of medical misadventure do occur in our health service, I believe it's very important to reassure women, and indeed their families, that maternal and perinatal health statistics in Ireland continue to indicate that Ireland is a very safe country for women to give birth. Indeed, our safety record and maternal mortality rates compare favourably with other developed countries. And I think it's important that we reassure people of those facts. The tragic death of Mrs Kivlahan took place in 2010. This was before the investigation by HIQA into maternal death in University Hospital Galway, and prior to the CMO's report into perinatal deaths at Portlaoise. I can assure the House that the actions required to address the recommendations of both these reports are being undertaken across our health services to improve patient safety and provide a more patient-centred model of care. A patient safety culture is now embedded in the HSE service plan through specific measures, including performance indicators for healthcare associated infections, medication safety and implementation of early warning scores, which did not exist at the time. My officials meet with the HSE each month on the service plan, and patient safety is a standing item on that agenda. The HSE has advised me that improvements in patient safety continue within maternity services at Sligo. The HSE is also focused on delivering improvements in the way that critical care is organised and delivered within the hospital group structures to ensure that patients receive the same high quality of care no matter where they are treated. Furthermore, as deputies will be aware, we are currently working on the development of a new maternity strategy for Ireland. Developing the strategy will provide us with an opportunity to take stock of our current services, identify how we can improve the quality and safety of care provided to pregnant women, and their babies. And this will include, obviously, both hospital and home care, obstetric-led and maternity-led units. The strategy will ensure that our services comply with the best available national and international standards. We want to make sure that women are provided with the right care in the right setting by the right people at the right time. While maternal deaths in Ireland are rare, I know that it is no consolation to the families who have suffered such a loss, but I can assure them that we are learning from the mistakes of the past and building on that knowledge in the present and endeavouring to ensure that they are not repeated in the future. In relation to Deputy Kelleher's specific question about intensive care beds and their availability, I've asked for a report on that myself this morning, and I did check out for myself this morning as to how many ICU beds were available at that point in time, just as a random test, and at least 2 were available this morning, but it may be the case that from time to time that's a difficulty. Deputy Daly raised a separate matter in relation to Philomena Canning. I understand that's a case that has been in and out of the courts for some time. I'm not fully briefed on that case, and I don't want to comment on a case that I don't know all the details of. But what I can say, and I know this for a fact, is that the HSE supports and provides cover for quite a number of community midwives. And there is no effort to reduce cover or remove cover for all community midwives. And I would suggest that if the HSE has decided to withdraw cover in this one individual case from this one individual midwife, that there may be a reason for that.
Congrats, Minister. Now, Deputy Daly, if a minute to...
Yeah, I appreciate the comments of the Minister that he's not fully briefed on the case. I would ask you that you would maybe look at it, because the reasons are, as I outlined, that she referred somebody to a hospital. This woman has an impeccable record, and sadly the antics of the HSE have left 10 women who are imminently about to give birth without somebody to assist them. And I'll just read you part of an email that I got this afternoon, and I got many of them. And this woman, who was 32 weeks pregnant, and Philomena Canning is her midwife, she says, women are entering hospitals and leaving in coffins. Women are leaving our maternity hospitals carrying their dead children home to be buried. 9 staff were found to have a case to answer in the death of Savita Halappanavar. Not one was suspended, never mind fired. All are still practising. Inquests in Sligo, investigations in Portlaoise. This is what the HSE call care. And she goes on to say, I'd rather birth on the side of the road than enter an Irish hospital as a pregnant woman. Now, the right to bodily integrity and to have a decision for yourself when and how you want to have children is and what should be at the heart of a proper maternity care system. And I would put it to you, Minister, to go back and look at this area, because there has been a deliberate undermining of community midwives. Maybe, I know you're only new in the department, but I would ask you to look at that case in order to help women who are at the coalface on this issue.
Thanks. 2 minutes to conclude your advice.
There's a few things. I really don't want to get into the Philomena Canning case, and may well be the case, Deputy Daly, that you may not know all the facts either. When the HSE withdraws cover from somebody, they tend to do it for a reason, not because an official gets a whim. It's often done for a good reason, and I think without us knowing the reason for this, we should confine our comments to it. But I'm probably closer to you on this issue than you may think. Pregnancy is not a disease, it's a physiological condition, and there's no reason why women who are having a normal pregnancy should not be delivered at home by a community midwife or in a midwife-led unit. Every pregnancy does not need to be dealt with by an obstetrician, and that is the kind of thing that the maternity review will look at. But whether it's an obstetrician or a midwife, I would put it to you that the HSE doesn't withdraw cover lightly or in a whim. They do it for a reason. Just in relation.